because they can make lots of money out of it. But what have you been looking at, Debbie?
Well, I've been just wondering what the public spending cuts are going to be and how they're all going to affect us, including possibly the rise of prescription charges. But then I find that the UKHSA, the UK Health Security Agency, are advertising for a senior diversity and inclusion advisor. Now, this is £46,000 a year, and apparently the government, despite promising to crack down on wokery, feel that this appointment is necessary. So this is £46,000. But if anybody wants to apply, it's flexible. You can work from home. And apparently the message or the banner is, let's talk about race. So the UKHSA obviously not having a problem with their budget.
Good stuff. And then what about the health protection report?
Well, this is very interesting because many people might know that the UKHSA are having their annual conference, and this was being held in Leeds yesterday and today. And we can see on the right-hand side Dr. Jenny Harris of the picture there, top right. And I just want to remind people, Dr. Jenny Harris is actually not just the CEO, or Dame Jenny Harris as she is now. It's not just the CEO of the UKHSA, but she's also the second permanent secretary to the Department of Health. Now, she didn't know that she was going to be appointed as that until she agreed to the appointment. She also used to be on the JCVI, so she's very vaccine knowledgeable, supposedly. And she was also a deputy chief medical officer. So, all of a sudden she's been accelerated to this massive post. Now, I will navigate people to a Royal Society of Medicine lecture that was held last year in June 2021, where Professor Simon Wesley was talking to her. And she said that the role of the UKHSA was as important as GCHQ, as important. She also said that the role of the UKHSA was to keep communities secure. Now, we've looked for a long time at the UKHSA, and Mike, I don't know whether you want to come in now, because you've been talking about fusion for a long time, and clearly we can see that we've got a fusion of health and security. And Jenny Harris and Chris Whitty were apparently present at this, and I think there's been quite a bit of backlash, actually. So I'd be really interested if anybody was in Leeds from UK Column, or that's one of the UK Column viewers or listeners. We would love to hear from you, because quite clearly the spooks, and that's what Jenny Harris has really admitted that the UKHSA is, it's spooks. So the spooks have spoken, Christopher Whitty and Dame Jenny Harris, and also the people have spoken. So that is the banner on the right-hand side. So if anybody was there, we would love to hear from you, please.
Yeah, I mean, I think that's right, Debbie. If we look, we're going to come on to bulk data collection and other things later on. But this is really what the UKHSA is about: is bulk data collection, and it's a form of surveillance, just like GCHQ. So it's not surprising they're using this type of language. But look, let's move on to all-cause mortality, because the Office for National Statistics has released their latest numbers. And if we look on the right-hand side again, we find another week of excess mortality with very little comment in the media about it. Nobody seems to care anymore about the number of excess deaths at all. Well, I showed some of these graphics that I'm about to show on Extra a couple of weeks ago, but I thought the general UK Column News audience should see this as well. And I want to get your thoughts on this, Debbie, because what is the cause of this excess mortality? If we look here from the Office for Health Improvement and Disparities, they are showing a bit of a breakdown of it. So we've got excess mortality with ischemic heart disease. We have cerebrovascular diseases here. We've got excess mortality there. We have excess mortality happening in other circulatory diseases, and also with respect to heart failure. But one area where I was a little surprised that we didn't have more, because it's actually not far away from what was expected, and that is with cancer. So, Debbie, I've been wondering over the last number of weeks, what is the main driver of the excess mortality that's going on at the moment? And I was assuming, because there really isn't any definitive information to be had about it, that it was being caused by, the lack of cancer treatment and so on. That certainly has been suggested in the media, that cancer patients are dying. But in fact, this data seems to show that it's not that. It's more heart-related than anything else. And of course, that brings us back to the question of vaccines. And just before you get to your comment, I just want to make this point. If we look through the mainstream press, the Guardian coverage of this, over 330,000 excess deaths in Great Britain linked to austerity. So it's not vaccines, it's austerity. Here's another Guardian article. Oh, they don't know anymore, because this headline is, well, it's Devi Sridhar, actually. And of course, she wouldn't want to mention vaccines at all. What's behind the mystery? It's a mystery of thousands of excess deaths this summer. And here's New Scientist. There are thousands more UK deaths than usual, and we don't know why. And Debbie, the point is, of course, we don't know why if we don't consider the possibility that vaccination may be a key driver of this, and we don't actually look to see.
Exactly that. And you know what, this has always been the big message, hasn't it? Whereas Professor Munir Mohammed is saying that the serious adverse reactions that we're seeing are coincidental. We don't know that, because we haven't ever had an investigation. We haven't been carrying out post-mortems. Many people who are dying currently aren't even associating their illness with a serious adverse reaction until we get an investigation. And I mean, an investigation like today wouldn't be a day too soon. In fact, it's 2 years too late. But until we get an investigation, we are never going to be able to eliminate it. So therefore, I believe it still has to be on the table. And I would also ask, slightly controversially perhaps, but for people's thoughts on many people suffering from long COVID and that are dying as a result, could be suffering from serious adverse reactions as well. But that's for another news, perhaps.
Yes. Okay. Thank you, Debbie. Any thoughts?
Well, I mean, we've said it all, really. We've pointed out all of this data. It's official data. There needs to be an investigation, but it needs to be a proper investigation and not the usual whitewash.
David?
Just one quick. I've been flicking through the Office of Health Improvement and Disparities version of this data, and they've lots of graphs, and you can change the nature of the graph quite quickly. It is interesting that the least deprived people seem to be suffering more from excess mortality than any other group, and it's not the most deprived. Isn't that odd?